What substances are detected by the chemical analysis of urine? First is protein. The presence of protein in urine is called proteinuria. Mild proteinuria in a concentrated urine may not be cause of concern, but proteinuria in dilute urine should be investigated since it may signal developing kidney disease. The significance of proteinuria is often determined by doing a second test called the protein-creatinine ratio. Proteinuria is usually assessed by a dipstick analysis. A small amount of protein might read as negative dilute urine at 1.010 but positive in urine concentrated to 1.040. A small amount of protein in urine is normal. This protein is derived from a small molecular weight proteins which pass through the glomerulus and are largely but not completely reabsorbed in the proximal tubule and from protein produced with the urinary tract. This amount of protein may register as negative at a specific gravity less than 1.035 or trace 1 plus at a specific gravity greater than 1.035. A protein of 2 plus or greater at a specific gravity greater than 1.035 or an amount of protein at a specific gravity less than 1.035 may be abnormal. When proteinuria is the only abnormality in urine analysis, one should evaluate renal function by BUN, serum creatinine concentration, and urine-specific gravity. Serum albumin should be measured to determine whether the proteinuria is of sufficient magnitude to cause hypoalbuminemia. Ketonuria is abnormal. Ketones appear in urine whenever the body breaks down excessive amounts of stored fat to meet its energy needs. The most common cause of ketonuria is diabetes mellitus, in which ketonuria is associated with glucosuria and hyperglycemia. Other potential causes are starvation, chronic catabolic diseases, persistent fever, impaired liver function, and hypoglycemic syndromes. Glycosuria. Normal urine does not contain glucose. Glucose should not be present in the urine of a healthy cats and dogs. The presence of large amounts of glucose usually indicates the pet has diabetes mellitus. Small amounts of glucose in urine may also be found in pets with kidney disease. The most common cause of glycosuria is a blood glucose that is more than 180 mg per deciliter that exceeds the renal threshold for glucose reabsorption. If blood glucose is normal, renal proximal tubular dysfunction should be considered. Bilirubinuria. Bilirubinuria can be normal in dogs but is always considered abnormal in cats. The degree of bilirubinuria should be compared with the urine-specific gravity. A trace to 1 plus bilirubin in concentrated urine or greater than 1.035 is normal in dogs. Urine sediment is the material that sediments out or settles into the bottom of the tube when a urine sample is spun in a centrifuge. The most common things found in urine sediment are red blood cells, white blood cells, bacteria, crystals, and tissue cells from different parts of the urinary system. Small amounts of mucus and miscellaneous debris are found in free catch samples. Red blood cells. Small number of red blood cells are often found in urine collected by cystocentesis or catheterization, but large numbers of red blood cells usually indicate bleeding. This may be caused by conditions such as bladder stones, infection, coagulation problems, trauma, cancer, and many more. White blood cells or pyuria. Small numbers of white blood cells in a free catch sample may not be significant, but in general, An increased number of white blood cells indicates inflammation somewhere in the urinary system. Inflammation is often secondary to bacterial infection. A few white blood cells in urine less than 5 HPF is normal. A greater number of WBCs indicates inflammation at or in advance of the sampling site. Bacteruria. The presence of both bacteria and inflammatory cells in the sediment indicates there is likely bacterial infection somewhere in the urinary system. Ideally, the urine should be sent to the laboratory for culture and sensitivity testing to find out what types of bacteria are present and which antibiotic should be used to treat the infection. Cylindruria. A few granular casts are normally present in urine from turnover of renal epithelial cells. Larger numbers of granular casts and other types of casts are abnormal. Increased numbers of granular casts indicate active renal tubular cell injury. The type of injury may be ischemic, toxic, infectious, immune-mediated, or traumatic. WBC casts indicate renal inflammation. RBC casts indicate renal bleeding. Crystalluria. It may be normal or abnormal and primarily indicates the presence of the composing minerals in the urine. Struvite crystals are common in the urine of normal dogs and cats. However, in the presence of radioiodescent uroliths, urinary tract infection with staphylococci or proteus, and alkaline urine, struvite crystals suggest that uroliths are also struvite. Epithelial cells. Squamous epithelial cells usually enter urine as it is voided through the vagina or prepuce. Other epithelial cells found in urine are transitional and renal, which are normally present in low numbers. Renal epithelial cells are small, just slightly larger than WBCs. The size of transitional cells varies markedly. Increased numbers of tissue cells are often seen in samples collected by catheterization, while this is not a sign of disease. Increased cellularity can be seen with a variety of disorders, including urinary tract inflammation, bladder stones, prostate problems, and cancer. Caudate cells are small transitional cells with a tail-like appendage. Large numbers of transitional cells are present with infection, inflammation, injury, and neoplasia. Under miscellaneous, it includes the presence of parasites. The eggs of Diatophyma renale in dog and Capillaria plica, which can be seen in dog and cat, may be found in the urine. Intestinal parasite ova may be found if the colon is inadvertently aspirated during cystosynthesis. Spermatozoa. Spermatozoa are often found in the urine of a male dogs. Sperm migrate up the different ducts and enter the urethra at the prostate gland and then reflux back into the bladder urine. Fat. Lipid can be found in urine of normal cats. Fungi. Fungi or yeast are usually contaminants during collection, in transport containers or in stain. Fungal urinary tract infection can occur, but it is rare. Some coliforms will assume a markedly filamentous morphology in urine and may be mistaken for fungal hyphae. And lastly, urobilinogen. It is many problems exist in the dipstick measurement of urobilinogen that evaluation is not recommended. False negative and false positive results are common. Thank you for watching this movie.